Hi, this is Stacy Chilemi, and I'm here from the Complete Herbal Guide. We're here today sitting with Tatiana Dell'Aquila. She's a physician's assistant, and she's here to talk about the O-Shot. So tell us a little about your practice.
Our practice was created probably 7 to 8 years ago, and it's my husband and I started it with the hopes that we could help our patients with natural methods to treat problems of health. We do a lot of things with nutritional, hormone replacement therapy, and also came about with the PRP therapy, which is for the O-Shot for urinary incontinence, or for use also for intercourse problems, painful intercourse and things like that.
Now, a lot of people don't know a lot about the O-Shot. Is there anything you can tell us, the benefits and all these things that can really help a woman if she gets the O-Shot?
Sure. The O-Shot was created by Dr. Charles Reynolds, and it was created because we were looking for different methods to treat common things like urinary incontinence after pregnancy and delivery of babies and vaginal births. It was also created for sexual dysfunction. There's a lot of women who are unable to reach an orgasm or have a lot of discomfort after menopause, so it was created for that purpose.
Now, a lot of people at a certain age have problems. What made you so interested to help people such as moms, with the O-Shot?
I think the most important thing is that there aren't a lot of treatments for both of these issues without having to go through surgical procedures. The great thing about the O-Shot is that we're using platelet-rich plasma, which uses a person's own platelets. And what we do is we take the growth factors and we can inject them into different areas where we can use them to regenerate cells. Moms in general, after having birth or having multiple pregnancies, will complain of urinary incontinence. Then also women after menopause will have a lot of discomfort, because of their hormonal changes, and also painful intercourse, or they just cannot reach an orgasm.
Now, have you dealt with a lot of moms? Have they mentioned these problems to you, that they're really experiencing a hard time reaching orgasm? Is it a common problem in the United States?
Yeah, I think what happens is that, first of all, there aren't a lot of treatments like there are for men, for example, who have erectile dysfunction. So women don't talk about it much, and in general, gynecologists will say, it's the aging process, you've lost your hormones, or even if your hormones are not optimal. So we do have patients who complain about these things, and optimizing their hormone levels may not totally get them there. Not to mention that there's a lot of physical changes, that happen in the vaginal tract during birth. The bladder becomes a little bit more weakened, so we can regenerate cells and help that with the PRP process.
Now, not just moms have this problem. This is actually a common problem that can occur at all different age groups, young and old.
Yes. Well, hormonal imbalances can occur at any age. So, you can have women who have PCOS, or women who have just irregular periods for a lot of reasons. So, hormonal imbalances will definitely contribute to some, okay? But there's also, trauma, and then menopause. So you can range anywhere between your early, 20s, 30s, up to, into your 70s, when there's a lot of vaginal dryness or just atrophy of the vagina due to, loss of hormones.
Now, from your own experience with your own patients, what changes have you seen after they have received the O-Shot?
We see a lot of benefits from it. The great thing is that because you're injecting your own platelets into the vaginal tract, what happens is that there's regeneration of tissue. So there's more comfortable intercourse with their partners. They happy sex lives leads to happy home life. So what happens is we have some husbands who are really happy that their wives or their partners are here now having better sexual outcomes. Also, as far as the urinary incontinence goes, it's something that troubles a lot of people. If you sneeze or you cough or you go to the gym and you're working out, it's it's embarrassing, but it's uncomfortable. So, we've seen a lot of changes with our patients who are very happy with it.
This sounds like a great procedure. Now, if they want to learn more about it, where can they find more information about the O-Shot?
Well, we have our website, which is Spatology, www.spatology.com, or they can call our office at 973-447-4380. There's also Dr. Charles Reynolds, who was the creator of the OSHA, has a website that has all information about it too.
That sounds great. This is really interesting, and I think it could help a lot of women, because this is definitely a topic women don't like to talk about. You know, this is something that most women experience, because I believe the statistics, when I saw, like 70% of women don't experience orgasms. And it's something that's out there, it's something that's very prevalent, and I think a lot of women can definitely benefit from this. So, you know, once again, if you need to know more information, if this is something of interest that you could relate to, go to www.spatology.com and ask for Tatiana, and she's the physician assistant here, and she'll be more than happy to help and answer any questions you may have. And can you tell us your phone number once again?
Sure, it's 973-447-4380.
Thank you so much. I really appreciate you sharing this information with us.
Thank you.